I'm Associate Professor Dr. Lim Soo Kun. I'm from the Renal Division, Department of Medicine, Universiti of Malaya, Faculty of Medicine. We are kidney doctors. We take care of those patients who have kidney disease. Of course, I think more importantly, we promote kidney health. If I tell you an organ in our body, which comes in a pair, which work 24 hours a day, 7 days a week, it filtered 1,000 gallons of water a day. Um, if it got damaged, it can be replaced. If you donate one, you can still lead a normal, healthy life. And it doesn't really do its own job. It's also help others by producing hormones, activate certain vitamins. So that sounds amazing, right? So that's our kidney, right? So I think it's due to the multiple functions of the kidney that basically make this nephrology exciting. But I just want to say many of us go into a subspecialty is mainly because of our early experience as well as training. So like myself, when I was in the Ministry of Health, I was actually posted to a dialysis unit to take care of the dialysis patient there, even though I'm very junior as a medical officer. I think from there, then with the early exposure and training, then I found this very interesting. That's why I take it up as a subspecialty training. We are one of the few transplant center in this country. There are only three center which can do kidney transplant in Malaysia. So we did the first spousal transplant in Malaysia. That was back in 1990s. And in the recent years, we actually embark on kidney transplantation uh, between the different blood group, right? Previously, many people think that if you have a different blood group, you will not be able to donate or receive the organ from somebody, but now it is possible. Yeah. So of course, this thing, if you look at overseas like Japan, they've been doing it for more than 20 years. But in Malaysia, we are at the starting point. But I think that gives a lot of people hope as well as opportunity to receive kidney transplantation and then gain the health of the kidney and continue their life. Nowadays, when we talk about chronic kidney disease, it's a public health issue. So we don't look at this as an individual or a patient problem, but it's actually a public health problem because in a study conducted back in 2012, we realized that in Malaysia, about 9% of the adult population probably have kidney disease. And this is probably an underestimation because this particular study was only performed in West Malaysia. Because of the resource constraint, we were not able to do it in East Malaysia. So in my personal estimate, we might be having like 10 to 12% of adult population having kidney disease. So you can imagine there's actually a very huge cohort of potential kidney patient. And this is actually closely linked to the diabetes because we know that diabetes as a main cause of kidney disease. The more diabetic patient we are expecting to have more patient with kidney problem. And the other things that we observe in the recent years is we are having an aging population and we are seeing more and more elderly coming in with a kidney problem. I think these two main factors basically make kidney disease actually very prevalent in this country. For anyone in the university setting, I think we are multitasking. We have to take care of our patients. We have to take care of our research as well as teaching. So I think our department, essentially the way to go is to get ourselves more focused because in the field of nephrology, there are many areas we can focus on. We can either focus in general nephrology, in chronic kidney disease. We can also focus in something related to autoimmune disease like SLE. We can focus on transplant. So there are many things that we can actually focus on. So what I get my staff to actually think is which area they actually want to focus on because we can't be good in every aspect. If you look at a lot of Western country and overseas center, they are the expert in the area. It's not because they have the sophisticated technology. It's because they do the same thing every day and they just get good at it. So I think this is probably the way to go. And of course, our hope is also university can uh, implement the multi-track pathway uh, so that the academic staff can choose what they want to focus on, whether in teaching, in the clinical side, or in research. being the oldest university in the country, basically, if you look at the clinical department, we have a full set of subspecialty to support us. We have very strong preclinical staff department to actually support us in terms of taking care of a patient as well as performing research. And I think this basically make one of the among the first choice for many of the candidates who want to study locally. If you want to talk about practical tips, the best thing is still healthy lifestyle, nothing sophisticated, right? You have to go for a very basic thing. Because nowadays, I think many people try to think too complicated. They are looking for drugs, they're looking for supplement to actually help their kidney, but they don't realize the most straightforward and easy way is to get a healthy lifestyle, prevent from getting these two particular disease, diabetes and high blood pressure. I think that is the best thing they can do.